All right, welcome back. And our conversation is continuing with the state's epidemiologist, Dr. Benjamin Chan. During
the break, we grabbed some of your latest questions. This one comes in from Kelly, who writes, what over-the-counter medication should we have on hand, particularly if a younger child were to get it?
Yeah, so there unfortunately are not any medications that can be used to treat the virus itself. There are a number of medications in research or under development, but those are not yet prime time, so to speak, for treating this virus. So unlike flu, which has over-the-counter medication or prescription medications which can be used to treat the infection, there are not currently any antiviral medications to treat COVID-19. Probably it's a good idea to have just the regular medications like acetaminophen, ibuprofen on hand to treat symptoms of infection.
The symptoms.
Yeah,
okay.
You've probably heard this one quite a bit. Diane asks, isn't it true that the 2019-2020 flu season is much worse than the coronavirus?
I would not say that that's necessarily true. We have experience from past flu seasons and from past new coronavirus episodes. So back in 2002, we had the SARS coronavirus, which had a mortality of, I believe it was about 10% or so of people with the SARS coronavirus died. MERS coronavirus in 2012, that was upwards of 30 to 35% of people died. So this new coronavirus in 2019 that has emerged is significantly less fatal than those past coronaviruses, but it appears to be more fatal than just a typical seasonal influenza. Based on data coming out of China, we believe that the mortality rate of people with COVID-19 is approximately around 2% of people with COVID-19 will die. The rate and the risk is higher for those who are older and people with multiple medical conditions. And so that number is actually higher than just regular seasonal influenza.
Yeah, we need to protect our older population.
Yep.
Robin writes in, wants to know if you can elaborate on how long coronavirus could maybe live on surfaces.
Yeah, and that's, I tried to get at that a little bit earlier with one of the questions. We're still learning about how long this virus can survive. There have been studies of past coronaviruses and other related viruses, but what I can say is that we believe this virus to be more fragile, so that when it dries out, it shouldn't survive very long on surfaces. But putting an exact number on this is still unknown. And I think we go back to the fact that this virus is very susceptible to cleaning and disinfection. And the primary way that this is going to be transmitted is person to person in close contact. There is the possibility for what we call fomite spread from, somebody who's sick touching a doorknob and then somebody else coming along, minutes, maybe even hours later and touching that doorknob and then, infecting themselves. But the primary way is going to be close person to person contact.
All right, Dr. Chan, this might be the last question. Greg asks, should people self-quarantine if they were at a location that is now closed because it's suspected or potential COVID-19?
So that's a great question and something that has caused concern in the community. I would say that if there is concern for a person being infected with COVID-19 or a group or a gathering where there may have been COVID-19, to please contact our health department because we don't like to react to rumors. We like to try and track down, was there actually somebody at a gathering with COVID-19? If there was, we would do an assessment through our public health investigation about what the risks were, who was in close contact with that individual, and people that are in close contact with someone with COVID-19, we would ask them to self-quarantine so that they're not in the public if and when they come down with symptoms of COVID-19.
Some good advice. Dr. Chan, thank you to you. And we just want to say thank you to all of our healthcare officials and workers in the state.
Absolutely.